the first paragraph in the paper kind of really summarises why we think this is an important issue right now. Really what we're saying is that paternal perinatal mental health is a critical public health issue. I'm just going to read the paragraph. It's not something I would normally do, but it'll just be a bit easier, I think. So both in terms of the incidence of poor perinatal mental health, paternal mental health, and the consequent negative impact on outcomes for mothers, infants, fathers, partners and families. So if poor paternal mental health isn't addressed during this period, then the risk is that not only will there be more immediate consequences for mothers, infants, fathers and partners, but that there will be the increased risk of longer term or lifelong negative impacts on the family unit, as well as a significant socio-economic cost. So the case is clear, I suppose. And again, this is what I meant when I said talking about some of the basics. So a lot of you will be familiar with this, but for those of you that aren't, putting this paper out, it's always important to remind ourselves why it's important, before we talk about paternal mental health, just the basics of why it's important that fathers and partners are engaged supportively with their families, and with why it's important for services to be engaged with fathers and partners. This sort of little list of bullet points here, it just really outlines what comprehensive research tells us. We tend to see when children are born into a kind of family unit where there is a supportive father figure, without going through them, in essence, outcomes for those children are more likely to be positive in all aspects of their life. So having a supportive father figure in the very early years is crucial. It's really important. And we know quite a lot about mums' mental health. Obviously, the National Perinatal Mental Health Agenda is mainly focused on mums and infant mental health. So we have all the information out there that tells us why mums' perinatal mental health is important. But we also know that it's very important for mums, for their partners to be there, to be supportive. Where we have supportive partners, where we have supportive fathers, then a mum is in a much better place in terms of being able to kind of deal with any potential perinatal mental health issues she might have. It will help her parent more confidently, and so on. So moving on from maternal mental health, it would be remiss of us not to relate the conversation of perinatal paternal mental health to the wider conversation that the profile of which has been raised quite a bit over the past week while of male mental health. So there's a question mark there. Male mental health, is it in crisis? A bit of a crude slide here, using some hard-hitting stats, I suppose, but it's really important to highlight this. I think more of us understand now that suicide is the biggest killer, unfortunately, of men in the UK under the age of 50. And every suicide is a tragedy. But the fact that the larger proportion of suicides in the UK is male, and in Scotland is male, it really is telling us something about the male psyche, and something that we really seriously need to be thinking about and addressing more. And obviously, as with everyone's mental health right now, what's going on with COVID and lockdown and all the issues that that's raising for families and for fathers, people's mental health is even more at risk. Interestingly, a couple of studies that were done in England a couple of years ago, where the tool that the health visiting service tends to use to form a conversation around mums around their mental health, the Edinburgh Postnatal Depression Scale, that was tested a couple of times with fathers, and what those little bits of research demonstrated was that, as it says here, men reporting of suicidal behaviour was significantly higher than their partners when screened during this period. Now, we don't have comprehensive evidence around this. We don't have comprehensive research or numbers or facts and figures around the links, if there are any, between male mental health in general and the perinatal period in terms of suicidal behaviour and thoughts. But I think what this little piece of research highlighted was that male mental health, as vulnerable as it is already, maybe even more vulnerable during this period, and tragically so in terms of what men are reporting who took part in this little test that was done down in England. Just some of the stats around perinatal mental health. So roughly 55,000 women in Scotland giving birth every year. And we know that roughly 1 in 5 mums will suffer from perinatal anxiety and depression. The reason that we have that stat, 10 to 15%, some people would say 8% of men suffer from perinatal depression, is because we don't quite have the numbers in terms of the research out there that we have for mums. But depending on what you pick up, this is what we're finding, is that really we're looking at between 1 to 2 men during the perinatal period will suffer from depression or an anxiety that they hadn't, oops, I've got some slides here, that they hadn't previously been suffering from. And just without getting into too much detail, the kind of red flags that we look out for mums in terms of what might tell us that a mum may be more likely to suffer from poor mental health during the perinatal period, the red flags are the same for dads. So, you know, history of poor mental health, or coming from a more deprived background and all that kind of thing. So these are the things to watch out for. So again, a study that was done a couple of years ago across the UK, led by the Fatherhood Institute, in terms of it was looking at fathers' engagement with perinatal services. So this is what we found, is that the vast majority of dads are there at least once during the antenatal period. So most dads go to at least one scan, which is normally the first one. Most dads are there, or partners are there during at least one antenatal appointment, and most are present at the birth. So dads are there, you know, and are present and are in the presence of services at least once during the perinatal period. So that should be a real opportunity, based on our vision in Scotland, our mental health strategy vision being that we want people to get the right help at the right time. Well, based on the evidence, the right time is the perinatal period, because that's when men's mental health is more, at one point in their life where their mental health is more vulnerable, but also the fact that men are there, men are engaging with services, so services should be equipped to think about paternal mental health and confident in engaging with fathers about their mental health, so they get the right help at the right time. But unfortunately, again, talking to fathers across Scotland, this study asked them what their experience was like. This is the kind of thing that was found. So, you know, 2/3 of dads were spoken to directly. What that means is that, 2/3, 3/4 around about. So around about 30% of dads didn't remember anyone actually engaging with them at all. Around about 30% were never asked to, encouraged to ask questions or raise concerns. Only half heard their name used. Using someone's name, as we know, is a really easy and good way to connect with someone. And what we know from those stats is that the fathers that fall into that 30% category will tend to be the fathers that we probably want to engage more, in the sense that as services, and this is beyond perinatal health services, but as services in general, we are more inclined to engage directly with, to use a generalization or a stereotype here, the more middle class or professional appearing parents that we are coming across. So the very people that we really want to engage, or who are more likely to be struggling during this period, are the very people that we're not talking to. And we know that we try as a health service to ask every mum about her mental health. But the fathers that took part in this study reported that only 16%, so between 1 and 2 dads out of 10 that took part, could recall ever being asked about their mental health. Not how is your mental health, but even just how are you doing, you know, how's things for you, that kind of thing. And clearly, given the evidence, given what we know, every dad should be asked to consider his mental health. So we're really falling really short here, and we're not meeting up to the national expectation that fathers get, that everyone gets the right support at the right time. So we need to do better there. It's, I think, very fair and accurate to say that there is probably not a single person who works within our perinatal services who intentionally excludes fathers or doesn't talk or engage with fathers. And we do mention fathers in our policy, in our strategies and so on. However, given the evidence, what we can kind of come to the conclusion of is that we are probably guilty of passively excluding fathers. We want to move away from that towards active inclusion, so that we are proactively thinking about and being prepared to think about how we engage with dads and engage with fathers' mental health in terms of service delivery. So our universal perinatal services should be father inclusive, and they should understand paternal mental health, but understand it in a way that so that staff feel confident on the issue, that they feel informed, and that they're able to engage in a conversation directly or indirectly in a meaningful way, so that dads engage with that in some way, shape or form and feel connected. before I go on to the recommendations, which is where I'm going to finish off, it's just to say that the National Perinatal Mental Health Framework have produced half a dozen or so modules about perinatal mental health, which anybody can access, which we've kind of taken part in. And there is mention of father's mental health, but given that each module has around about 32 pages, I would say that in amongst all that, there's maybe at most a couple of pages that refer specifically to father's mental health. It's not really enough. It isn't really giving staff the time in those services to think and to reflect on their practice properly, because essentially what I think we've learnt from working with perinatal services is that father inclusion and male maternal mental health, while everyone knows it's important, it's not something that's necessarily ingrained within practice from the learning and so on that staff have taken part in before. So our 6 recommendations are these. This was kind of kicked off in part by the release of the National Perinatal Mental Health Fund that was released for the voluntary sector just a few weeks ago. So £1 million each year for 3 years for the voluntary sector across Scotland. 15 organisations across Scotland benefited from that. 90 applied for it, so there was a lot of disappointed organisations, I guess. And we were concerned that no organisations who were really focused on or whose raison d'etre was to kind of think about the other parent, fathers and partners and so on. Recommendation 1 is that we, in the same way that maternal suicide is recorded, we think there needs to be parity in relation to paternal, partner and carer suicide rates during the perinatal period. Suicide and the causes of suicide is very complex. However, this simple, crude, I suppose, mechanism is something that happens with mums, and it's probably something that we think should happen with fathers as well, because it would help bolster and raise the profile of the issue, possibly tell us something that we maybe don't know enough about in terms of the risk for fathers during this period. It says there, the second one, that paternal partners and carers GPs are informed about a baby's birth. Speaking to colleagues in health services, there is maybe an assumption that when a child is born, the child's parents both have the same GP. So if you're a father or a partner and your partner gives birth, and you both have the same GP, then your GP will know that you've become a parent. But if you don't have the same GP, then that's not the case, and that's very often not the case. And again, if you go to a GP with some kind of concern, if you're maybe feeling a bit anxious or stressed, or you really need to talk to someone, but maybe, as we know, many new parents either maybe don't associate how they're feeling with the fact that they've become a new parent, or don't want to necessarily volunteer that information. If a GP is not informed about the fact that you are a new parent, it's not going to really help him or her build that, whole picture around maybe who you are and where you are in your life. And it's not just GPs. GPs, again, here it's a crude measure. But what information do health visitors get from the referee services and so on about who the partner is? And very often we're finding out that health visitors maybe aren't quite getting all the information they need. We've asked the Perinatal and Infant Mental Health Programme Board to commission some research on this link, if there is one, between the perinatal period and maternal suicide. They've tentatively agreed to do that, so that's a kind of amber light that we've got here for this one. So I won't say any more about that, so that's a positive step. And this is something that I think a lot of people in the room today really want to focus on, and possibly the one recommendation that we'll be focusing on more so today is the fact that we think that third sector services across Scotland support male mental health and potentially suicide prevention are adequately funded. Again, a very crude statement to make here. We raised it with Hugh Masters, the chair of the programme board, on Tuesday morning. We met with him. And we made it clear that we understand that, the old, we need funds, we need more resources and so on. It's that age-old problem that is very, very simple to solve in one way, but really hard to do, especially at the moment when we know that we've got another big crisis that we're having to fund and deal with right now. But Hugh agreed that it's really important for organisations like everyone that's around the table today to put this forward as a serious recommendation so that we don't forget this, that it is important. We do require resourcing and support to continue to do what we need to do. And given that the peer support study was released a couple of days ago, peer support is something that a lot of you here today do, and it's something that the NHS is going to be focusing on for the next wee while, amongst other things. And we know from the report that peer support is, in terms of geographically, it's patchy and it's not universally accessible to families across every health board in Scotland. So the last two recommendations are more in relation to Fathers Network Scotland, which I'm sure you've had the chance to read. I'm not really going to get into that. We've not been backward and coming forward. We can't really afford to, like everybody else right now. But this was, I guess, was our paper that we put forward, so we had to put our case forward there. But that's as much as I'm going to say, other than these, I think, are probably the key questions that I felt we want to look at today, but maybe people feel differently. So how can we raise the profile of this issue as a collective? How can we build the capacity across our organisations, and how can we ensure that action is taken? You know, what are these actions? So that's as much as I'm going to say.